to the show. Today on Oprah, we're going to Marshall, Texas, where we're going to take you step by step through the life of Joy Landers, a 23-year-old woman who had a rough start to motherhood. Joy wrote to us about her pregnancy, her battle against the odds, and how it affected her life. Here's her letter.
Dear Oprah, during my first 2 pregnancies, I had an opportunity to sit around and watch countless hours of TV. I saw tons of shows that were attempting to take a real-life look at pregnancy. I saw shows like Jenny Jones, Rosie O'Donnell, and A Baby Story, and they all said the same thing. Having a baby is so easy and wonderful. Well, I'm here to say that it's not all peaches and cream. There are some women like me out there who have a really hard time with it. Not every pregnancy is ideal. I miscarried the first 2 times I was pregnant, and now I've recently been diagnosed with preeclampsia, and I'm terrified. The doctors and nurses are great, especially the nurses. Would you do a show representing women like me? Maybe it would help me understand better and get through this. Desperate, Joy Landers, Marshall, Texas.
Well, we did decide to do a show about women like Joy, and who better to be the star of that show than Joy herself. In light of her condition, we came to her in the comfort of her country home in small-town Texas. Joy has been diagnosed with preeclampsia, a life-threatening pregnancy-induced condition. She has been ordered to bed rest, and even though she was already 37 weeks along when it was ordered, it is still hard to lie in a bed all day long. Before we talk to Joy, let's consult with Dr. Marjorie Handelhoff.
Well, Oprah, preeclampsia is a pregnancy-induced hypertensive disease in women who are previously normotensive. It's also a systemic vasospastic disorder, wherein the normal increase in blood volume is countered with, is met with spastic vasoconstriction in every system of the body. This is going to infect all of basically your body systems, your renal system, your GI and cardiovascular in all areas. Normal pregnancy does involve a normal increase in blood volume. However, this is countered with an equal vasodilation within the body, so it doesn't cause any problems. I think it's also important to note here that there's going to be a 5 to 7% of the population that's infected with this disease and that encounters this every day. Also, it is a leading cause of infant and maternal mortality. Also, this is used to be called toxemia.
Oh yeah, that's what we always called it.
Oh, that's really outdated. We really don't use that phrase anymore. However, a definition to preeclampsia is going to be an increase in blood pressure volume, and that's going to include probably 140 to 160 systolic and about 90 diastolic if we don't have a baseline on the woman. However, if we do have a baseline on her blood pressure, it's going to be generally a 30-degree increase in her systolic and a 15 or so increase in her diastolic. This typically is going to occur after 20 weeks gestation, which is about 5 months pregnancy or so. It also involves hemoconcentration, hypertension, proteinuria. There's also sometimes edema that's going to be associated with fluid shift in the body. Proteinuria also may or may not be present until seizures occur. Eclampsia, the term eclampsia, is just a worsening of the condition of preeclampsia, and it's going to be associated with grand mal seizures. HELLP syndrome is referred to as hemolysis, elevated liver enzymes, and low platelets, and this usually occurs in the 3rd trimester. I really do need to get this, so I'm sorry.
Just real quick, Dr. Handelhoff, what's the cure for that?
It's just delivery, plain and simple.
Here we are at the house of Joy Landers. Now that we understand the pathophysiology of her condition, let's meet Joy. Hi, Joy. I just want to start by saying thank you for being on this show, and I know our audience is thanking you at the same time. How are you doing today?
Well, I just first of all want to say thank you for coming. I can hardly imagine that you're in my house. So fun. And I know there are tons.
I'm making myself comfortable.
And I want you to. And there are tons of women I know that are so glad that you came. And it's not for me. It's just because I want other women to know this is a big deal. I mean, I'm sitting here all day long, and I know I haven't had any bed rest like some of those women. But I'm trying to write some poetry and put into words like the things that are going through my head, the things I'm scared of. It's kind of helping me cope with it a little more.
Sure.
Yeah, but...
Well, how are you feeling?
Well, actually last week when I went to the doctor, they told me I have high blood pressure. And they gave me all these lists of symptoms that might go along with it. And a headache was one of them. And today, for the past 3 days, I've just been having a dull headache. It just won't really go away. And I've been taking some Tylenol, and it just isn't helping at all. So I'm thinking maybe I have my home health nurse's number here. Her name is Sandra Lauren Clark. I've heard she's real good. And I forgot her number here, and she told me to call her anytime something's wrong.
Let's call her.
Okay, yeah,
Let me grab the phone for you. I saw it right here. Here we go.
Okay, yeah. I think it's 214-485-3906. Hold on just 1 minute. Let me talk to you. Hi, is Sandra there? Yeah, this is Joy.
Sandra, you must be Sandra.
Hi, I'm Sandra. I'm the home health nurse.
Yes, come on, she's back here.
Okay. Hi, how are you?
I'm fine. Okay, thank you.
Hi, I'm Sandra Lauren Clark. I'm the home health coordinator for Joy Lander's case. Oprah had asked me to talk to y'all about what are the community concerns for this patient. Currently she's in the high-risk antepartal unit, so the community aspect of it is pretty much over at this point until postpartum. When we release her, we'll want to involve her in the local resources. But I just wanted to give you a little bit of a look at, for those of you viewers out there who may be struggling with this disease, what you can expect if you come in contact with preeclampsia. What we do for people in the community is so that they can manage their disease at home, we will have a community nurse check on them in protocol. Calls for a nurse to come out 2 to 3 times a week. In Joy's case, we went ahead and came out every day because of the severity of her case. Typically, we will weigh them, and as long as they don't gain more than 1 pound a week, it's okay. We're going to do urine dipstick because we want to make sure that protein in your urine is okay. We'll measure the blood pressure, and we always want to do it sitting down in the same arm, okay? And fetal movement counting is also critical. We want to make sure that it's got to be at least 3 an hour. If we feel less than that, that's cause for concern, I think. Subjective symptoms are important, and in Joy's case, I mean, that is what tipped us off. I mean, if she hadn't told me about the headache and we could, you know, crisis manage and get her into the clinic, where would we be? You know, she would still be at home, okay? So, I mean, that is just critical. Teacher patients, your home health nurse will come to you and say, if you have a headache, if you feel different, if the baby's not moving, you want to pay real close attention to that, okay? Write that down. Another thing is, we're going to do an ultrasound. Obviously, during pregnancy, that's a common thing. But what we're looking for is fetal growth, the biophysical profiles. I mean, that's a way for us to see, is this disease affecting your baby? Okay, that's what they're checking for. Non-stress tests, typically once a week. You can expect that. And we also want to get your friends involved. You know, I don't want to be the only person visiting you. We want to make sure that since you're stuck in a bed, that you have somebody coming to see you. You have things to do. The important thing about being in the bed, too, is you need to be on your side for the most part. You don't want to lay on your back. And a standing up woman's going to have edema in the lower part of her body where the hydrostatic pressure is at its greatest. But when you're laying down, it's going to be in your back area. So that's somewhere where you can expect to see that. You want to eat lots of roughage, your fibers, your fruits. You want to have lots of water. We don't want any constipation. I don't want you to have constipation. Gentle exercises are critical too. We don't want you to get stiff. No muscle atrophy, please. Family needs to be involved. And you really need an out. You know, you need some kind of relaxation.